Hi everyone, my name is Katie and I'm going to be the instructor for this workshop that is called Ethical and Legal Considerations for Palliative Care. This is going to be one of the workshops in a series called Enhancing Palliative Care in Acute Care Settings. I'm going to tell you a little bit about myself before I go on to talk about the workshop. I have been a nurse for 8 years, and before that I was a tech for roughly 6 or 7 years, where I worked on an inpatient psychiatric unit. And then once I became a nurse, I started working in med surg, where I have stayed. And I also worked on an inpatient psych unit along with a correctional facility. I currently work on a med surg unit that is called acute care for the elderly. So it's anybody above the age of 65 that has any acute medical needs. I am going to go on to talk about the target audience is practicing nurses in acute care. And this will just be education that is done for nurses that are currently working inpatient. The duration of the workshop is going to be about an hour long. And the title is Ethical and Legal Considerations for Palliative Care. This topic comes from where I currently work, where we have come across issues with documentation, such as healthcare proxies in most forms, not understanding exactly who is required to be around to sign these forms and how they can be overridden and such. There will be case studies and discussions on ethical dilemmas, such as withholding or withdrawing treatment. There will be presentations on relevant legal frameworks and guidelines, along with group discussion on ethical decision making in palliative care, and talks about things that people may or may not have seen in their working environment. So, one of the documents that we will talk about is a healthcare proxy and how you have to be over the age of 18 in order to be a proxy, along with create a proxy. And this is somebody that can help make medical decisions for the patient when they are incapacitated. Along with another form we'll talk about is the MOST form, which talks about life-saving measures, code status, if you can be intubated, along with returning from back to a hospital, the use of IV antibiotics, things like that, and how they have to be signed in order to be comfort care. Then something else that will be talked about is the living will. This is something that is created while you are living and can make decisions for yourself and have them documented. And this is to ensure that whoever you appoint to be your healthcare proxy, that they follow the wishes that you would like if you were to ever become incapacitated and not be able to make your own decisions. The power of attorney is another legal form that is created. It's not necessarily healthcare related when it comes to making decisions about your life and any treatment that you would be getting, but it could become needed if you cannot make decisions for yourself or have been deemed to not have capacity and need to go to another facility after the hospital. This could be something that is needed. Then we will touch on a couple of questions that have come up in my practice, and we can touch on any questions that maybe you have come across. So one of the questions is, the patient states that they have these documents, but they have not brought them in. What do we do? A patient just had surgery. Some facilities require the patient, depending on the procedure, to no longer be a DNR DNI for up to 24 hours after surgery. Kind of what just happens in the time frame around that. Another question is, what if the primary proxy isn't making decisions or is not available to make the decisions? Some healthcare proxy forms have a primary and secondary proxy, so how we go about finding that out and going from there. Talking about how a proxy can change a MOST form. If you were DNR, DNI, how they can change you back to a full code. And then talk about how capacity is determined, because some of these forms can just go right through the patient. You don't have to worry about anything else. Unless they are deemed to not have capacity, then that's when it becomes a concern. These are just a couple of things that I plan on touching on in the workshop, and if please bring any questions that you have, and I look forward to having this workshop with you guys. Thank you. Bye.